my name is Amy Kimberly Marshall, and I am a registered clinical counselor in good standing with the British Columbia Association of Clinical Counselors. I am currently completing a PhD in industrial organizational psychology and have acquired a master's degree in clinical psychology and a bachelor's degree in clinical psychology. I'm an executive contributor for Brains Magazine, which has been recognized as the #7 business magazine in the world, and I have a private practice. Throughout my career, I have had the opportunity to work with a wide range of clients. I utilize an integrated, holistic approach to counseling with a primary focus on a mind-body relational perspective. I am passionate about my work, and I believe that each individual is unique and change is always possible. I work collaboratively with my clients and offer empathetic listening, compassion, acceptance, and support. Mental health issues that can stem from lupus. Living with lupus can have a profound effect on a person's mental and emotional health. According to a study published in BMC Psychiatry, depression and anxiety were prevalent in adults with lupus. Clinical depression may be a result of the ways in which lupus physically affects your body. Clinical depression may be a result of the continuous series of emotional and psychological stressors associated with living with a chronic illness. Between 15 and 60% of people with a chronic illness will experience sometime in their lifetime clinical depression, and up to 37% will experience anxiety. Clinical depression also produces feelings of anxiety, which can also aggravate physical symptoms, such as headaches, stomach pains, fatigue, etc. Mental health issues that can stem from lupus. Depression often develops with lupus because this autoimmune disorder disrupts daily activities, which can lead to isolation and discouragement. Emotionally, this can also lead to frustrations and feelings of hopelessness. Anxiety from the unpredictable nature of flare-ups can become stressful. When these factors emerge together, the chances of developing depression increase drastically. Having a chronic, unpredictable disease can cause uncertainty and anxiety. Those impacted may wonder how the disease will progress, whether you will be able to stay independent, or how you will manage physically, emotionally, and financially. Depression. This is an illustration of the cycle of depression, and it shows that symptoms of depression encourage maladaptive behaviors, which exacerbate stressors and lead back to worsening of symptoms. Conceptualizing depression as a cycle is useful when discussing the benefits of behavioral activation and challenging irrational thoughts. This diagram shows how stressors externally impact an individual's thoughts, feelings, and physical symptoms, which impacts behaviors. CBT is a triad where an individual has thoughts, feelings, and behaviors, and the cycle of depression is a clear illustration of that. Primary symptoms of depression. If you live with lupus or you know somebody that does, watch for these primary symptoms of depression. Feelings of sadness, worthlessness, and hopelessness. Rumination on negative thoughts, failures, and mistakes from the past. Changes in sleep patterns, disrupted sleep, insomnia, or too much sleep. Changes in eating patterns, irregular or low appetite, cravings, or emotional eating. Anger and irritability and emotional outbursts. Lack of mental focus, where everything seems to take more effort and there's a challenge concentrating. Lack of interest in activities that are normally enjoyable, such as hobbies or socializing. Physical symptoms such as headaches, body aches, and back pain. And with moderate to severe depression, suicidal ideation. Supporting someone with depression. If you have depression, you can ask those around you to support you in these ways. Or if you are supporting someone with lupus that suffers from mental health issues, here are some tips. Recognize that depression is an illness. It can affect anyone. Anyone can develop depression even if they seem to have a good life. It is also situational and does not have to be lifelong. Make a point to reach out. Many people with depression isolate themselves, often falling out of touch with friends and family. You can't make someone accept help, but you can provide the option. Check in regularly, invite them to talk, and emphasize your support. Just listening can help. You don't have to fix your loved one's problems or convince them that their negative feelings are wrong. Even if you would disagree with any of their thoughts or feelings, it is important to respect and acknowledge that these experiences are real to them. Be supportive of healthy habits. Exercise, healthy eating, healthy sleeping, and socializing are all contribute to mental health, and they also help combat depression and anxiety. Support these activities by giving encouragement, offering to accompany your loved ones, or providing positive feedback. Encourage professional help. Mental health counseling and medication are effective in treating depression. If your loved one is unsure where to start, offer to help them find the right provider, such as a physician, mental health clinician, counselor, psychologist, or psychiatrist. Connect with your loved ones with social support. In addition to helping them find professional help, your loved one may also benefit from other sources of support. This could include community organizations, religious groups, or mental health support groups. Making time for self-care. Supporting someone with depression can be frustrating, tiring, and emotionally draining. It's okay to take a break. Make sure you are getting adequate sleep, eating nutritionally, exercising, and taking time to relax. Stressors that can come from living with lupus. Living with lupus means that you may deal with several stressors at the same time. Just the long process of getting a diagnosis can add stress and frustration. Many people go several months or years living with undiagnosed lupus symptoms. This uncertainty can be an invisible load on a person's mind until they get more clarity and medical support. Some of these stressors may include difficulty enjoying life due to the unpredictability of symptoms, uncomfortable changes in your body, physical limitations from pain and fatigue, being unable to fulfill usual parental work or social roles and duties, added medical costs and appointments, time spent managing or treating symptoms, and isolation. Reducing situational stress. Life can often be stressful, and most people have things in their life that are difficult or feel impossible to change. However, there are many stressors that we experience which are situational and to a degree in our control. No matter what kind of stress you have in your life, any efforts you can do to reduce it can have a positive effect on your mental and emotional health and your overall well-being. However, sustained stress will elevate stress biochemicals such as cortisol, which can take a toll on your mood as well as your body. Even if you can't find ways to reduce specific stressors, you can still find activities which can counterbalance the stress in your life. There are many activities you can do that will reduce the cortisol levels in your body and bring you feelings of calm, peace, and control. Self-care and reducing stress. This is a list of different activities that can help you combat stress. Deep breathing, meditation, visualization, relax with quiet music, yoga, 7 to 9 hours of sleep, good nutrition, exercise, massage, meaningful conversations, fun activities with family or friends, spiritual activities, setting goals and steps to achieving them, delegating appropriate responsibilities, realistic scheduling and planning, journaling, hobbies, and time with pets. Taking care of your mental health and getting support through therapy. Stress can make you feel overwhelmed and isolated, but remember that you're not alone and there are people that can help. Depression, fear, and anxiety are some of the most common and uncomfortable emotions that we can experience at some point in our lives. Through therapy and treatment, you are given the tools to recover motivation, perspective, and joy that you once had in your life. Cognitive behavioral therapy has been proven to be especially effective in treating depression. Counseling can help you deal with any negative thoughts and feelings while providing objective guidance towards your personal growth. Therapy is a process designed to produce lasting change in your life. The goal is to help you grow from your struggles, heal from your pain, and move forward to where you want to be in your life.